Welcome everybody. Just so everyone knows, this meeting is being recorded, so if you miss part of it or have to leave early, we will have it for you. All you got to do is ask and we will get it to you. Just want to make sure everybody can still hear me okay. If we could send back a chat or two. Sherry, can you can hear me okay? Awesome. Thank you so much. All right, well with that, we're so excited today to get going. We have a brand new product. AHCP has been working hard to build their exclusive line with our insurance company, NHIC, National Health, and we have a great product to share with you guys today, a short-term med product. It's going to be fantastic. Great commissions, great product, something that you can call your own. Not everybody's going to have access to, so just great. And so with that, let's get going. All I ask is you guys please put your questions in. We'll address all of your questions at the end of this meeting. All right, here we go. AHCP is excited to announce Intrium Care, short-term medical product. This product is brought to us from Life Association, and the association comes with a lot of other benefits that's also available on NHIC's other proprietary products like Trio Med and AHCP. So there are great travel services, deep discounts on travel, identity theft protection, one of the best kinds of protection that we can have today. We see every day in the news how important this benefit is. Healthcare services, so this product comes with CallMD, hospital negotiations, senior medical alert, and more. Retail store and gifts, deep discounts there. Dining and entertainment discounts, and then family benefits also, savings on groceries, office and school supplies, VPI pet insurance, and more. So how fun, now you guys can also offer that type of insurance. So really great stuff. I don't know about you, but I do get asked about that quite a bit. So great lineup here, and let's look at the product highlights on this short-term medical. One of the best parts of this product is that it's using the Aetna network. As you guys know, Aetna is a large trusted network, so it can be used so many places, and you're just not going to have a problem finding your customers' doctors in their network. They get 3 doctor visits. The plan is going to pay $50 per visit. It's not subject to deductible. And what's really great is that it also offers an unlimited urgent care visit for $50 copay, also not subject to the deductible. What I love about this, you guys, is that if they do run out of their doctor visits, they still have unlimited urgent care. And as most of us know, with these short-term plans, that's not typically the case. So I really love that feature. There are mental health benefits available on this program. 11-month terms are available in most states, and that is the truth. In most of the states that this product is approved, there is an 11-month term, so that's another great feature. There's no price difference between the 6 or 11-month terms. The same benefits regardless of the policy term, so that's not going to change. I know we see that on some of our other short-term plans, so that's definitely a positive. All of the payment options are month-to-month payments, so where we sometimes see a price break where they buy out the whole term up front, that's not the case here. At this point in time, there's one choice for payment, and that is month-to-month, and that's great for you guys, great for the customer. Flexible plan options, there's 3 deductible options, 4 co-insurance options. We're going to review all of that. Next day effective date available, like most short-term plans. Choice of any date effective date as early as the next day, up to 30 days following enrollment. And there is 2 6-month term rewrites allowed and 1 11-month term rewrite allowed on these plans. Okay, so there's just a quick brief overview. Now let's look at the product availability map here. Currently we are available in the states that are highlighted in green, and as you know, NHIC is always working to onboard more states, and we'll make you aware of that as they are onboarded. But really, for a launch, this is a really nice product map. I really like what I'm seeing here, and you know, for those of you that are licensed in multiple states, I think you can see you have some wide range here. So good stuff. Let's take a look at the coverage outline. So what we have here is we have two basic programs. On the top here, we can choose either $1,000 or $2,500 deductible, and then the coverage is the same outside of the deductible. There's a 50-50 coinsurance option with a $2,500 max coinsurance and a $250,000 lifetime max, a 70-30 with a $1,500 coinsurance max, an 80-20 with a $1,500 coinsurance max, and then 100% coverage with obviously a zero coinsurance max, and then the lifetime max amounts are $1 million outside of the first option. They can choose 6 or 11 months coverage depending on the state that they're in, and so as you can see, all of these options are the same. Now, if they're trying to save a little bit of money that's not in their price point, whatever the reason may be, they can jump up to the $5,000 deductible option, and now the coinsurance and max out-of-pockets change a little bit. So on the 50-50 option with the $5,000 deductible, the coinsurance max jumps to $3,750. On the 70-30 option, the $2,250 deductible, I'm sorry, the $5,000 deductible offers a $2,250 max coinsurance, and then on the 80-20 option, it is a $2,000 max coinsurance, and then obviously the 100% option is still at zero. The lifetime max amounts did not change, and the coverage term options did not change either. So this is all going to be really about what your customer can afford and what type of coverage they want. Now, the per person deductible is capped at 3 times the individual for family greater than 3. So what this means is that when 3 injured family members satisfy their individual deductibles, the remaining individual deductibles will be deemed as satisfied for the remainder of the coverage term. So really simple stuff, right? We've definitely seen more confusing things in our lives, and this is pretty straightforward, pretty simple. I think we're going to see a lot of sales in this range because the price on this product is pretty good, and I think you're really going to enjoy you know, this top option. But they're both really phenomenal. Now let's look at the plan details a little closer. Pre-existing is pretty typical of most short-term plans. It reads pre-existing conditions for which medical advice, diagnosis, care, or treatment was recommended or received within the 12 months prior to the effective date will be excluded from coverage unless a lesser period is required by state regulation. So, you know, every state's going to be a little bit different. Free look period. There's a 10-day period to return your certificate for a full refund. In some states that may be different. That's the general rule. Length of coverage, like we've already discussed, there is a choice of a 6 or 11-month coverage term. The 11-month coverage term is not available in all states. We do have that information for you. We can definitely get that to you once you get appointed with this product. We'll get you over all of that, you know, all of those minute details. And then coverage rewriting. Certificates are non-renewable. Reapplications are allowed twice for a 6-month coverage term and once for an 11-month coverage term, not to exceed 24 months of combined coverage. So after 24 months, I'm going to have to take a break and come back. So that's pretty typical of many short-term plans. So really great. This is going to work for most of our customers, and Good stuff. So let's look at the actual plan features and the benefit details. Emergency room, they do have unlimited visits subject to an additional $250 deductible unless they're admitted to the hospital. So obviously that's trying to prevent our customers from using the emergency room as a doctor's office. And then ambulance benefit, unlimited trips, the plan will pay up to $250 per trip. Doctor's office visit, we've already reviewed this, but really great feature. The plan will pay up to $50 per visit for the first 3 visits per coverage term, not subject to deductible or coinsurance. Any additional office visits subject to deductible and coinsurance. Urgent care, unlimited, awesome, $50 copay per visit and then deductible coinsurance. Skilled nursing facility, 50 visits per coverage term. That's really great because that's per coverage term. And then the plan will pay up to $150 a day. Mental health outpatient benefit. I love that this is included. So great. Maximum of 10 visits per coverage term. The plan will pay up to $50 a day. Home health care benefit. Really great. Maximum of 60 visits per coverage term. That's really a high limit. Love that. A visit is defined as up to 4 consecutive hours of home health service in a 24-hour period. And then a transplant benefit is also included at $100,000. Before we get into the commission. So really great stuff here. When you guys get appointed, you will receive you'll have the full brochures, and all of that will be available on our website, for you to download. And, this is pretty simple, pretty straightforward information. Now, this is the most exciting part, right? Before we get into the enrollment and all of the other details, let's talk money, because that's the most important thing for us. We all want to sell great products, and AHCP has a lot of great products, but where they differ in short-term medical, it can be pretty minute. One of the things we're going to see with this plan is that the underwriting is very simplified, which is great, and the commissions are higher. When we looked at who is our biggest competitor and who are we really up against, United Healthcare probably has one of the best products out there for short term. It's priced well, it has a nice network, but those of you that sell a bit of it know that their underwriting can be a little bit tough, especially on blood pressure, cholesterol issues, and the commissions are decent. So here we're going to crush that plan on both accounts, and I love that, because I love it when we can come out with something and really be competitive, and on this product we are. So let's take a closer look. The commissions are a little bit hard to explain, so I'm going to make it as simple as possible. The commissions you're being paid on in a few different ways. You're being paid on the actual plan, okay, depending on whatever your commission level is. You're going to be paid on what you sell, but you're also going to get paid an 8 to 10% commission on the association fee, and you're paid a one-time flat commission on the enrollment. So, and that's either 15, 20, or 25. Most of you are probably at 15 unless you're in a management role or, higher commission role, and if you are, you'd be paid higher. So when we look at it all in, what you're getting, it's between 18 and 20%, including those fees. So that's pretty nice. Now, what's really great about this is most short-term plans out there do not pay you a commission on the enrollment fee or the association fee. They're just built into the plan. So really great. This is going to help you get your commissions up on that front. So really great. Love that. I mean, we love making money, right? We don't love working for free. So wonderful. And then this is really great too. There's only 6 knockout questions, and those of you that sell a bit of short term know that this is the key right here. We want down and dirty. We want it to be easy. So 1, a yes response to questions 1 through 4, or a no response to question 5 will result in a declined application. are you, whoopsies, these are done a little bit wrong. So there's really only 5, and they just populated in 6 steps, but that's okay. Are you or any applicant now pregnant and expectant father in process of adoption or undergoing infertility treatment? Are you over 300 pounds if a male or over 250 pounds if a female? Super liberal, right? We can't argue with that. Within the last 5 years, has any applicant been diagnosed, treated, or taken medication for or experienced signs or symptoms of any of the following: cancer or tumor, stroke, heart disease, including heart attack, chest pain, or had surgery, COPD or emphysema, Crohn's disease, liver disorder, degenerative joint disease of the knee, alcohol abuse or chemical dependency, or any neurological disorder? Within the last 5 years, has any applicant been diagnosed or treated by a physician or medical practitioner for acquired immune deficiency syndrome, AIDS as we know it, or tested positive for HIV? And have you been hospitalized for mental illness in the last 5 years, or have you seen a psychiatrist more than 5 times during the last 12 months? And if you are not a U.S. citizen, do you legally reside in the U.S. for the duration of the policy? So they're not saying you have to be a U.S. citizen. They're simply wanting you to be here legally, which is extremely fair. As you guys can see, these are not the 6, but the 5 knockout questions. And really, really simple. I love this. This makes our job so much easier, right? We're going to look at the application in full so that you have a better picture of that. But those are the key 5 items that we need to be looking for. Now, really great. You're going to have an agent link. Okay, so you'll be able to access your agent link to run a price quote and complete the enrollment. So super easy. Like so many products nowadays are offering, we are also making it really simple to get your customers enrolled and get their cards printed and done. So this is what it will look like. You can look at the prices and start the enrollment, as you can see right here. This is what it will actually look like. This is where it's explaining the life association and what the membership provides. And like I said, this isn't just some silly-nilly life association either. It's really actually great benefit. So good, and they do a nice job here of giving a little summary, okay, and what the maximum coinsurance options are. And then they'll put the zip code in to start the process. You have to enter all applicant information for the short-term product only, and this is going to calculate just the short-term medical rates. And then the quoter will run quotes in all states regardless of product availability. Therefore, you must refer to the state availability map before pitching the product to your customer. Child-only plans are not available, so that's a really important thing to remember. And you must enter a first name for every applicant in order to load the rates correctly. So it can't be left blank. Okay, so easy to remember. And again, this guide will come with you. When you get yourself appointed for this product, you're going to have access to this. Cross-selling with buy-up options. So as you guys know, NHIC is building their product portfolio, and this is now the 3rd product in there. So if you're cross-selling your customer with any of the buy-up options available, add the buy-up product to the cart and delete the basic association package. So that's one of the things that's new. The way this product was filed and the way that it is available to customers means they have to pick an association plan. If they choose one of our other products, AHCP or TrioMed, there is an association built in, and that will replace the basic association package, okay? So the great thing is when you sell the basic association package with it, which you have to pick, do one or the other, that's going to fulfill it. Now, if you sell AHCP or TrioMed, you're going to be paid a commission on those plans and not the basic association package. So let's just be really clear about that. It negates that, but you're being paid more because obviously those plans have higher premiums and they pay higher commissions. So important stuff to notice. But you know, the quoting is going to make it super easy for you to figure out yourself. There is a note here: if the member already has an active AHCP or TrioMed plan and they are now applying for the short-term product, you must delete the basic association package from the cart, and no buy-up options may be enrolled. Okay? And if there's any questions or concerns, our office is definitely here to help you guys. So really easy to add the buy-ups on here. And look, cross-selling is key. It's key for our commissions. It's key for our customers' protection. So I love that they're making this really simple for us. Such a great program that they've put together here. Now we can see right here, choose the correct short-term plan from the drop-down menu. So it's nice, you can see right there all the choices and all the price differences. So they make that really easy to pick. And then obviously right here it's allowing you to pick you know, the network fee. And you know, there's a one-time enrollment fee. AHCP buy-up plan, so here the prices are a little bit different. Okay, and then so this is how it would look all together. You have the short term, and then you have the AHCP buy-up, and then it's showing a total of $298. So this is as an example if you were to pick this. If you were to pick TrioMed, it would be a little bit different. And then you're going to choose the effective date. Really simple, as you guys know, it can be next day. Complete the customer information. If enrolling multiple members in the short-term or buy-up plan, ensure all dependents are added to the application that are applying in either plan. So obviously you want to make sure of that. Okay, so they make it simple. Any dependents listed on the short-term quote will carry over to this enrollment page. To edit, you can click on the paper icon with the pencil. So maybe you want to, you know, change that person's enrollment. You can click here, making it easy. Now here's an example of the actual application. You know, the questions that are going to be asked. They make a note here to ask the applicants all short-term medical application questions verbatim. This is coming from our call center. You guys are not being recorded, obviously, unless you're an agent that's running a call center yourself or working, you know, in that type of environment. There would be similar requirements, if not exact requirements. But bottom line is the questions are the questions. Okay, so if you're just a regular agent that sells insurance, this is how you would. These are the questions that would be asked. So you're going to choose the policy length. And then you're going to start the question. So, you know, as you guys can see, pretty simple. We'll go through them. Will any applicant have other health insurance in force on the policy effective date or be eligible for Medicaid? Are you or any applicant either now pregnant, an expectant father in the process of adoption, or undergoing infertility treatment? Over 300 pounds of male, 250 of female. We know that, you know, that's obviously a knockout question. Within the last 5 years, has any applicant been diagnosed, treated, or taken medication for, or experienced signs or symptoms of the following: cancer or tumor, stroke, heart disease, including heart attack, chest pain, or had heart surgery, COPD, Crohn's disease, liver disorder, degenerative disc disease, rheumatoid arthritis, kidney disorder, diabetes, degenerative joint disease of the knee, alcohol abuse or chemical dependency, neurological disorder? Have you or any applicant been hospitalized for mental illness in the last 5 years or seen a psychiatrist more than 5 times during the last 12 months? Within the last 5 years, has any applicant been diagnosed or treated by a physician or medical practitioner for AIDS or HIV? And if you are not a U.S. citizen, do you expect to legally reside in the United States of America for the duration of this policy? So super simple. and we've already reviewed the knockout questions. And then you're going to help your customer choose their preferred payment method and complete this section. As you can see, it's super easy, intuitive, and the application is not complete at this point. Even though you're going to see the confirmation page, you must obtain the insured signature either by voice, which most of you are not doing it that way, or by e-signature. So that's what 90% of us, 99% of us actually are probably going to be doing, is the e-signature. And so this is really important to make sure that we capture that part. And then once that's all done, the great thing is you get the cards right then and there. So for your customers, security and to build trust between you and them, you're able to deliver the cards immediately. Now, if they've enrolled in one of the buy-up plans, the temporary ID cards will also show on the confirmation screen. So if they just bought the Intrium Care short-term, it's this. But if they've also selected a short or a Trio Med or an AHCP, which hopefully they did, you will have this option, and you'll be being paid more commission, which is hopefully what all of you are excited to do. So really nice professional cards. Now let's look at some of the important enrollment information. If buying a buy-up plan, the buy-up plans, AHCP or Trio Med, based on availability, will not terminate at the end of the short-term policy term. Therefore, if the member doesn't want to doesn't want to continue their buy-up coverage, they will need to notify member services of their intent to cancel. All other charges associated with the short-term medical will be termed with the short-term medical coverage. So for example, the network fee and the short-term medical product fee will terminate at the end of the short-term medical coverage term. Hopefully that makes sense for everyone. Current AHCP or Trio Med policy holders. So some of you on this call have been selling AHCP and Trio Med and are thinking you might want to reach out to those customers about this new product, and that's great. If a member already has an active AHCP or Trio Med product and they are requesting an application for the short-term medical product, the basic association package must be deleted from the shopping cart at the time of enrollment. There is only one product with the association benefits allowed to be enrolled at one at a time. So what they're saying, in layman's terms, is no person can have more than one association package. They cannot purchase two. So because they're embedded in our products, this is an important step. Effective date, active date. The active date will be set as a default to the next date following enrollment. If, however, the applicant wishes to choose a date other than this, you must choose the date from the drop-down when filling in the customer's information. If the applicant is applying for a buy-up plan, their effective date will automatically be set to start on either the 1st or the 15th of the month following enrollment, in accordance to the normal product effective date rules set for these products. And then billing date. The reoccurring billing date will be determined by the date of enrollment. The member's billing will be drafted on the same day each month following enrollment. If a member signs up on the 15th of the month, their recurring billing date will be set to occur on the 15th of every following month, even if their effective, there's a typo there, right? If their effective date is requested to start on the 1st of the following month. All policies or all policy parts will be bundled for the payment, including the buy-up plan charge if buying. Okay, so that hopefully makes sense to everybody. It makes it easier for you, makes it easier for your customer. There is a 10-day free look period that applies to the short-term medical product. If within 10 days from the product effective date the member decides to cancel, they may choose to get a full refund, including the enrollment fee, and any potential claims will be forfeited in lieu of their refund. No refunds will be credited after the 10-day free look period has passed. We do not prorate fees either, so important to know. Cancellation policy: if a member is requesting cancellation after the 10-day free look period has passed, they must provide a minimum 10-day cancellation notice to be delivered to member services in a written format, either via email or fax directly from the member or from the agent on behalf of the member. So we make that easy. Their coverage will be canceled effective at the end of their current coverage period, no sooner than 10 days following the date the cancellation notice is received. If the member purchased a buy-up plan, they may opt to continue their coverage provided by the buy-up plan. They may cancel it at the same time as the short-term medical. So pretty simple. And again, we will help at our home office with any of this, so don't be too stressed out or confused or concerned. And then the last important enrollment note is all members will have instant access to their plan documents via the member website. They'll need their member ID to register for their access. This is available to all members directly following enrollment and includes access to their temporary ID cards, as we reviewed. Every member will receive this information in their welcome email. So makes it easy on you guys. They get their information immediately. It's not confusing. It's not hard. And so the last thing would be is, questions, especially on contracting. That's what Sherry Blackwood, she's here on the call with us today. If you are in our elite program, you're more than welcome to schedule a one-on-one with me. If you have a quick question, you're more than welcome to email Sherry or I, and one of us will get back with you regarding the actual product. But you know what, guys, the product's pretty straightforward, pretty simple. And the most important thing you can do is get appointed to sell it, because the sooner you get appointed, the sooner you can sell it. So let's talk for just a moment about why would you sell short-term medical right now, and what's going to happen in the months to come. Just because we have open enrollment coming doesn't mean we don't have a tremendous opportunity with this product, because let's not forget, not everybody wants a permanent plan. Some people just hate Obamacare, and for that reason they don't want to participate in it. We're going to have those people. We're also going to have people that can't afford the products, even if they have a small subsidy, that maybe it's still out of their price point. You're going to have people that just need in between coverage. They're going from one job to another, or one situation to another, or whatever. So short-term medical is a product that we could sell all year round, during open enrollment, after open enrollment, and lots of opportunity for it. So getting appointed with it sooner than later is definitely your best bet. And short-term is some of us might think, well, why would somebody forego the penalty, or why would they pay the penalty and forego that coverage? Why would they make that decision? Well, you got to remember, you guys, even though we have this open enrollment, and some of us think it's great and some of us don't, the bottom line is affordability. And those fines that are assessed to people who choose not to have ACA coverage, it comes out of their tax return. So there's no lien put on them or levy or anything like that. If they don't have ACA coverage and they're fined, well, it will just come out of their return. And the truth of the matter is, many people don't care about that. That's not scary to them, and they would rather know that they have themselves and their family members protected, month after month, and in a way that they can do that affordably. And some of these people, especially in these 11-month states, that makes more sense to them, and they feel just fine with that coverage. And so it's nice to know that we have this, and some of us that have been agents for a long time definitely know that this is the case. So do we have questions? Let me look. Is Florida on the radar? Yeah, all states are on the radar. So we just have to, be patient. They're working hard to get, obviously, as many states as they can, because that's in their best interest. And then, can you show an example of a sale and the accompanying commission. It would be nice to see that laid out. Yeah, that's a really great idea. What we can do is get that together and maybe send it out. I can't use the quoter while we're on the webinar. Unfortunately, you guys won't be able to see it. But that's a really great suggestion. So I definitely like it. I'll put it in our next presentation and add it to the recording. So do we have any other questions? I was asked about the 2 rewrites on a 6-month and 1 on the 11-month. We did talk about that. If there's any questions about that, right now is a great time to ask it. All right, Sherry, well, do you want to say a few words to the gang? Sherry, can you hear us? Oh, her audio's not working, unfortunately. But you know, those of you that have worked with us for a while definitely know Sherry and know that you can count on her and you can email her for anything that you need. And hopefully you guys are excited as we are about this. I mean, this is a really exciting time for us at AHCP and, you know, VelaPoint and NHIC. Creating our own product line is just wonderful, and we love to be able to give you guys the opportunity to tell your customers, you can only get this from me. How awesome is that? Love that. So take advantage of that and make a ton of money with this product. And if you have any you know, questions or concerns, definitely reach out to us. You can call me direct. My phone number is 248-495-0224. But don't, you know, hesitate to just send any questions via email to Sherry at the email you can see on the screen. If it's something that's that I can help you with, she'll go ahead and forward it to me and I'll contact you. So everybody, I really appreciate your participation today and your enthusiasm about the product and everything that we're doing here at AHCP. And we are just so excited to be moving forward with you guys. So everybody, make it a great day today.